Hello everyone, my name is Jared Byer. I'm a health coach. I've had 25 years experience as a health coach, and I want to put this presentation together more as a current events for 2020. Obviously 2020 has been a very difficult year, dealing with the pandemic and lockdowns and things like that. So what I want to really present are some things you can actually do to really keep your wellness up, do as much as you can to prevent illness. If you do unfortunately get sick, ways you can actually help boost your immune system. And there are several things you can do. So a lot of this is what I consider self-health, things that you can do in support of your wellness team, your doctors, counselors, family members, community members, anyone that's around you, building a team of people that can actually help and support you. So hopefully everyone is well at this point in time, and I want to present some topics in this 6-part series that will progressively build on what we're talking about in this first presentation, to discuss how certain ways, things that you can do to improve your wellness in the year 2020. So part 1, basically this is a year we'll never forget, right? Things that have happened this year have never happened before in history. So we don't know. Fear of the unknown and not knowing what's going to happen in the future, as in addition to what's going on right now, is very difficult. So I'm trying to help do this presentation to help people navigate their own wellness so that we can better work together and hopefully end a lot of these problems that we have. So the main 3 things I want to talk about is how is this affecting your mental health, your chemical health, and your physical health. So mental health is basically going to be your mindset, right? So we have a lot of negativity going on right now, a lot of fear, much of it fueled by media and things like that. And there's a lot of doubters. There's too much information. It's hard to navigate what's true and what's not. So that's what I want to really present in this 6-part series. There are things that you can rely on as factual, and you can obviously develop your own wellness program around that with advisors. The second part is your chemical health, right? So we're using a lot, when I talk about chemical health, it's really mostly about what's in your environment, chemicals we're exposed to, especially now because we're cleaning a lot more, using hand sanitizer, things like that. Also the food that you're eating, right? So we're obviously now, restaurants have been shut down for a while. Obviously there's a lot of pickup and things like that. So people are more involved in cooking food for themselves. So there's a lot of more people baking bread for themselves. Obviously there was rationing and food supply shortages that we didn't foresee. It was supposed to be a 2-week lockdown that turned into, who knows when this is going to change. So the chemical side of it is obviously nutritional as well as chemicals we're exposed to, because again, with us cleaning things more and more, there's more chemicals that our bodies are exposed to. And then the physical side. So the physical side meaning, how active are you? A lot of us are, because gyms were shut down, a lot of people were avoiding outdoor spaces, staying indoors a lot more. So those things negatively affect our physical health. As well as gyms being shut down, people were not going to gyms, obviously, and we're avoiding a lot of places, public places, because of other people. And obviously we can't control other people. We can only do as much as we can for ourselves. So 2020 has been a very interesting year and continues to be like that. So I want to provide as much information as I can in terms of things you can do for your own health that will help yourself, people around you, and hopefully everyone in this country and world that's been affected. Okay, so in terms of our U.S. health, in 2020 the U.S. ranked 30th in the healthcare index. So that's basically the quality of our healthcare. We're obviously a very powerful country, but the access to healthcare has been difficult, especially because so many people, with all this testing and people testing positive in these lockdowns, it's been very difficult to use our system. The main things when all this stuff broke was we didn't want to overwhelm our hospitals, which obviously happened in New York City and all that stuff, and all these big cities. Those were the hotbeds. Those are hard areas to deal with. So ranking 30th is basically, we're moderately equipped for this, but it's the access to these things. Testing was very difficult in the beginning, and keeping people informed was difficult because there was so much misinformation. The main thing in the U.S. which really affected us with COVID was that Americans have very poor health, okay? Americans have a lot of chronic illness. Things that are not going to kill us, but that weaken us to something like this that can overtake our immune system. So things like diabetes, obesity, heart disease, high blood pressure, your age, advanced age, any type of compromised immune system. Now the one main thing that the US, as opposed to other countries, had as a main limiting factor or pre-existing condition was obesity. We have a lot of obesity in this country, and that puts a lot more strain on our body. So the more strain we have, the weaker we are to fight things off. Our system is really very reactive. We're not very proactive in our approach to healthcare. So unfortunately, a lot of what we do is after the fact. Again, this was supposed to be a 2-week lockdown that's turned into months and months of lockdown and restrictions. So a lot of this, what I look at is the survival of the fittest, right? You have to work on things to make your body strong, your immune system, to deal with these things from a mental, chemical, and physical perspective. So one benefit here, I'm trying to put some positive spins on these things. I think this year our flu season, which is just around the corner, might actually be a bit less this year because people are washing their hands more and people are using masks and trying to stay away from people more. So I think this year, hopefully our flu season should be less because we don't need more added onto this pandemic or these issues. So I think that will be a positive light, that we have a less impactful flu season. So just a couple things just to reiterate with COVID-19. Here's some of the symptoms laid out. Now some of these could be experienced by anyone. So unfortunately a lot of people think they might have it if they have fever, chills, cough, some of these basic things, nausea, vomiting. The main difference, which I highlighted, is new loss of taste or smell. That is one of the main markers of COVID. Now, a lot of people don't actually have symptoms. So you may not experience any symptoms, but you may be a carrier. So those are things that are up in the air. I mean, we're still learning things day by day about this, but that is the one main thing to look at with COVID, which is not usually related to other illnesses or viruses. So that is one thing to look out for. Now, secondary to that, emergency symptoms. COVID is a lung problem. It's a lung eater. So the main thing to look at is these are things to look at that need emergency care if you're experiencing these. So work with your doctor, hospital, everyone if you have these symptoms, because these are all indications of breathing problems, which puts stress on your heart and can create cardiac arrest and all types of problems. So the main thing to look at is really working with your healthcare provider and not overreacting, but these conditions, as opposed to the previous slide, are serious. So you need to really take attention, immediate attention to these things and work with your practitioner. Don't just put things aside. All right, so face masks. Obviously, there's a lot of contention with face masks, and rightly so. There's a lot of misinformation on most of this COVID information. But basically, N95s were the masks that were used primarily by healthcare workers, and they filter the most. They have a plastic filter on the front. They are the highest rated surgical masks or protective masks because they actually fit very well and they do have that pressure. The main thing is that healthcare workers are the main ones who should be using these. Most states, obviously it's been a state by state, not necessarily a national recommendation to use cloth masks, at least in public, that people do not need to use N95 masks. But I'm sure everyone has seen a vast array of masks, from clear masks to helmets to everything. So the main thing is that most of these masks, cloth masks, really just protect you from getting things on your skin, right? Or hopefully into your respiratory tract. But the main thing is they have to be worn properly. I'm sure you guys have seen tons of people with around their chins, not over their nose. It's got to be nose and mouth, has to be protected. A proper fit and seal is also very important. So even if you use a cloth mask or one of those sock things, they have to kind of surround your mouth and nose as much as possible. And they should be clean, because as you know, these viruses do survive on surfaces for a certain amount of time. That amount is debatable in terms of the sun exposure and, light, humidity, things like that can change it. But the main thing is we want to make sure we clean those masks periodically or have several masks. I'm not a big fan of disposable masks because usually they're the cheapest material and it just creates a lot more waste that we don't need. So reducing the spread is very important because this virus needs human hosts. If we break that cycle and don't give another host, it can't keep replicating. So that is a key. Don't be a host. So as much as you can, try to help people around you. It's not the biggest thing to wear a mask. I mean, nurses and doctors, everyone's been wearing masks for decades, right? I mean, this is something that's just routine in an office, whether you work with a dentist, whether you work anywhere that's a medical-based practice, they're going to be wearing masks. So it's not something that if you have to wear the mask in a grocery store or shopping center for a couple hours, it's not going to negatively affect you because healthcare workers wear them almost all the time. So just be aware of that and make sure you use the right information. So obviously the social distancing is very important. Obviously 6 feet, being outdoors is, you don't need a mask as much if you're not in contact with people. Lockdowns and store closings are obviously, there's a lot of things that we expected to have that just weren't there. Again, we thought this was going to be a 2-week cycle of just lockdown, everything would be good, and it's continued on much, much longer. So again, obviously using masks in public as much as you can. We can't control other people don't want to do that, and hopefully they don't contract it and they don't transmit it, but there's a lot of misinformation and you have to make sure you get your information from the right sources. So again, conflicting information. What is your source? Where is that coming from? Fact checking is very, very important. The new normal is, how long is this going to continue? How many people are going to wear their mask for the rest of their life? If you're a germaphobe, this is probably the worst situation for you because everything is going to be a potential danger. And that heightens fear levels. So I really believe that the mental aspect of this is the most harming because it's going to last the longest. People are going to be afraid to touch other people, to be around other people. Being careful is very important. Obviously, if you're on your family, especially if you have older, your grandparents or parents have some underlying health conditions, those things you have to be very careful because you might be carrying it and you don't know it. So asymptomatic people are dangerous as well. Now the last thing I want to talk about in this slide is about a COVID vaccine. So there's been a lot of talk about obviously trying to get this vaccine, and it's all new and they're rushing to do this. Right now there's actually what's called Operation Warp Speed. So what that is, it's a government funded project where they're trying to funnel as much money as they can. Right now there's $8 billion invested in 7 different vaccines, hoping that one of those is actually going to work. Now, in the last couple months, I've actually talked with 2 virologists about this topic. And the one thing we will look at is that they're trying to have this vaccine hit 50% effectiveness, which would be outrageous. That would be phenomenal. However, in decades of research with the flu vaccine, the highest rate they've ever really hit was 30%. So over time, they've kind of figured out, but the flu mutates quite a bit more, right? Every year there's a different flu that's going to be going around, and they're trying to anticipate which flu it is, so hopefully they have the right flu shot for that. But this is all new. So right now, we're just hoping that this is going to work. And if anything, they're looking at January of 2021 of hopefully getting a vaccine which works and has limited side effects, but really getting that over to healthcare workers and people that we need to keep everyone else healthy. So the main thing to look at is hopefully this vaccine is going to work, or one of the 7 that this Operation Warp Speed is going to benefit. But they're looking at 300 million doses by January of next year. Now the general public might not be getting this until the fall of next year. We don't know. Hopefully there's limited side effects because with everything there's a give and take. But hopefully that's going to be the case, that this money and this time spent of the world really trying to figure this out is going to be well spent. So the summary for part 1 is what we want to do in 2020 is really, it's given us time to evaluate who we are and how we do things, because we've had to change so many different things. A lot of businesses have been affected, especially small businesses, restaurants and things like that, and obviously there's been a tremendous amount of unemployment and people losing their jobs, and just trying to make ends meet has been very difficult. So that's why I always say in 2020 we are on survival mode. This is something that brings us back to our roots, that we have to try to find a way to get through this. And I think we've done a pretty good job of it. Obviously, over 200,000 people have died thus far that have had COVID or some related illness that has caused them to pass away, unfortunately. But the main thing is you have to be in a survival mode, and you have to take your personal health, your family, your community, and do as much as you can there, because starting with one person is the way this is going to change. So those are the keys. Self-health and social support are very important. You need a team of people to work with you and support you. There's so many unknowns right now. You need to attack this with more than one person. You can't just do this on your own. So these are important factors to look at when it comes to 2020 and just your general health. So this presentation is 6 parts. This is the first part, which is more the overview, and then each part will kind of delve a little bit deeper into the different topics. So again, your mental health, your chemical health, and your physical health. These are the ways that I approach this to really give you pertinent information based on facts and based on my experience over the last 25 years to really give you credible information that's going to help you. So hopefully there's something in the 6 weeks that's going to bring you to give you some more information. Obviously there's a ton of it out there, and I a lot of times, even myself, when I'm going through this stuff, trying to figure out what's credible and what's not. And that even before all this stuff, the amount of false information for health and wellness was obscene. Now it is far beyond that. And there's been lots of people and companies trying to benefit from this, selling different products and services, and you have to be very careful. So I just tell people to be an informed consumer and do as much as you can to get credible research from the right sources, because there's just way too much false information out there. So the more you can do to benefit yourself, and hopefully this series is going to give you some tips that I hope that you enjoy and get some information from this next 5 videos. Thank you.